Hello, for my Capstone case study analysis, I decided to conduct my research on the pharmaceutical firm known as Pfizer. A brief overview. Pfizer was founded in 1849 in Brooklyn, New York by two cousins named Charles Pfizer and Charles Earhart. Now, Pfizer is considered the second largest pharmaceutical manufacturer around the globe. Now, despite their success, Pfizer faces legal, political, and technological forces in the marketplace. Pfizer is now learning how to navigate social challenges such as drug price scandals and healthcare reform, and exploring opportunities for growth and profitability. Pfizer's primary mission. Pfizer's mission is to be the premier innovative biopharmaceutical company. Now, their purpose is to innovate, to bring therapies to patients that significantly improve their lives. Now, Pfizer's core values are customer focus, community, respect for people, performance, collaboration, leadership, integrity, quality, and innovation. When it comes to Pfizer's overall strategy, they use a blockbuster business strategy, which includes developing value-creating drugs with the expectation of having $1 billion or more in revenue. Now, Pfizer's business segmentation are split into three parts. Now, first is the Global Innovative Pharma, known as the GIP, and is focused on the development, registration, and commercialization of value-creating drugs that save lives. The second is the Global Vaccines, Oncology, and Consumer Business, which works under the GIP as well, but this area focuses on vaccines, oncology, which includes cancer research, and working with consumer healthcare businesses. The last one is the Global Established Pharma, which focuses on legacy products that have lost market exclusivity and reestablishing those products back in the marketplace. When it comes to Pfizer's human resource management, let's first address the four core concepts of human resource management. Recruiting. Recruiting is how does a firm recruit talent to its firm. Selection is which people does the firm select. Compensation is how do you pay your employees? What type of salary do you offer? And what benefits do you offer? And training development is the techniques you use to improve your employees. So when it comes to recruiting, Pfizer recruits top talent to maintain premier status. When it comes to selection, they select the best candidates out of their recruiting pool. When it comes to compensation, Pfizer offers competitive salary, and they offer benefits such as health and wellness benefits, financial counseling, life and health insurance, and they offer nutrition counseling. When it comes to training, they use traditional techniques such as individual development plans. They encourage manager peer reviews, and they use a job rotation, which is where they rotate employees on different projects and different tasks to make them more well-rounded in the workplace. When it comes to products they use, each business segmentation has a different primary product. So under the Global Innovative Pharma, which includes research areas in inflammation, cardiovascular, metabolic, neuroscience, pain, and rare diseases, this includes Eliquis and Lyrica. Now, it's under the Global Vaccines, Oncology, and Consumer Healthcare. Their main products are Advil, Centrum, and Nexium. Under the Global Established Pharma, products include EpiPen, Zoloft, and Lipitor. Now, do any of Pfizer's primary products account for more than 25% of sales? The answer is yes. Now, Pfizer's Comirnaty COVID-19 vaccine accounted for over 45% of sales and generated over $36 billion in revenue for the year 2021. When it comes to target market, Pfizer's target market is healthcare providers and patients, and they use a direct-to-consumer advertising strategy to educate individual consumers on prescription medicines and vaccines. They use television ads, digital ads, and in-store advertisements to teach consumers the benefits and side effects of their medicines. When it comes to Pfizer's pricing strategy, they use a differentiation strategy, which means they produce products at acceptable costs that stand out in the market. Pfizer's prices are higher than most to maintain a premier elite status. Now, Pfizer's growth is dependent on raising the prices of drugs and vaccines. Because of this, they face constant media attention, societal pressure, and political pressure. And as we end the COVID-19 pandemic, the government will no longer be the primary buyer of COVID-19 vaccines. which Pfizer has planned to raise their vaccine prices to $110 to $130 per vaccine. And once again, this is viewed as business as usual for Pfizer and taking advantage of consumers. When it comes to distribution, Pfizer sells their products to wholesalers, retailers, hospitals, pharmacies, and clinics, which is part of their indirect distribution channel, which is where they sell their products to, again, wholesalers, not directly to consumer. When it comes to the vaccines, they sell vaccines to provider offices, the Center for Disease Control and Prevention, and wholesalers. When it comes to promotion mix, Pfizer uses government officials, healthcare specialties, celebrities, and everyday people in their advertisements. They use product claim ads, for example, such as an Eliquis commercial. They tell the consumers in the commercial what Eliquis is used for, how it treats you, and the potential side effects of Eliquis. Again, they use direct-to-consumer advertising to educate consumers. When it comes to public relations, Pfizer uses public relations to establish and communicate Pfizer's ethical standards and commitment to all stakeholders. Now, but also they use public relations to effectively communicate their business plans to fight back against government pushback, societal pressure, and negative media attention. Pfizer's competition is Merck, Novartis, Johnson & Johnson, Moderna, and Bristol Myers Squibb. Pfizer's market share is 5%. Now, out of the competition, the top three that have a market share compared to Pfizer is first, Novartis, which is a 5.3% market share. Merck has a 4.7% market share, and Johnson & Johnson has a 4.6% market share. When it comes to international sales, Pfizer doesn't base their sales based off country to country. They do geographic regions. Now, the regions include United States, developed Europe, developed rest of the world, and emerging markets, which includes China. Now, the United States accounted for 36.59% of sales. Europe accounted for 22.56% of sales. Developed rest of the world accounted for 15.3% of sales, and emerging markets accounted for 25.47% of sales. Now, what are issues that could impact Pfizer sales going forward? Well, in Europe, they're facing inflation and a low energy supply. And emerging markets, they are facing currency issues and inflation. And then here in the United States, they are facing inflation, high interest rates, and a looming recession, which could negatively impact Pfizer's international sales. What is Pfizer's outlook? Well, Pfizer's future outlook for growth looks negative. Because of the reason why is, well, first, Pfizer loses patent protections in the years 2025 through 2030 on products such as Eliquis, which will result in the rise of generic competition. Now, it's also, scientists predict as we enter out of the COVID-19 pandemic, the demand for a COVID-19 vaccine will decrease. So the question now poses, what are ways Pfizer could do to combat this potential negative outlook? Well, Pfizer is focusing on merger and acquisitions to acquire pharmaceutical firms to help boost revenues, and they're also developing new medicines in their research areas, such as respiratory syncytial virus, commonly known as RSV, migraines, and ulcerative colitis, to change Pfizer's future outlook. When it comes to test analysis, it includes Pfizer's political, economic, social, and technological analysis. Now, the area I talked about the most in my research paper was the political area. For years, Pfizer faced political pressure due to their drug and vaccine prices, and they also met a lot of pushback from politicians who ran on healthcare reform and to stand up to big pharma. So during 2020 and from then, they worked with the Trump administration, then the Biden administration, to develop a COVID-19 vaccine to prevent COVID-19 transmission. And during this time, they repaired the relationship to work on issues in the healthcare industry. When it comes to the strategic group map, I did product quality and revenue ranking. I wanted to see if the higher quality products that cost more have higher revenues, or do the lower quality products but are cheaper produce more revenues. Well, the group map shows that Johnson & Johnson was number one in revenue, was ranked number two for product quality, Pfizer was number 2 in revenue, but number 1 in product quality, shows that the firms that have the better quality products have higher revenues. And this is why these companies are under a lot of criticism, because they're the ones that have the best medicines for life-saving treatments, and they constantly raise their prices knowing that people will still buy them anyway. When it comes to Pfizer's social responsibility, their social responsibility statement is, our valuable resources allow us to do more for people. Using our global presence and scale, we are able to make a difference in local communities and around the globe. So next part of this social responsibility is the connection to the triple bottom line. The triple bottom line consists of people, which is how do you serve all your stakeholders? Planet, what are ways do you reduce your ecological footprint? And profits, how do you use your profits in meaningful ways? And Pfizer, I believe, does live by the triple bottom line. When it comes to people, they serve all stakeholders. They promote diversity and inclusion. As they participate in philanthropy efforts around the globe, and they build a valuable workplace culture. When it comes to planet, they work hard to reduce their ecological footprint by investing in renewable energy, managing natural resources in their facilities, and a focus on environmental sustainability moving forward. Now, despite claims that they raise drug and vaccine prices to inflate the revenues, they do use their profits in meaningful ways in the world. They use it to develop new science, create new life-saving treatments, and generate healthcare innovation. Now, an update. So our case study, and now there's been quite a few changes at Pfizer. So the class textbook has Ian C. Reed as Pfizer's chief executive officer. Mr. Reed retired in 2009 and was succeeded by Dr. Albert Bourla. The COVID-19 pandemic has led to the creation of the Comirnaty vaccine, which boosted revenue. Now, the textbook also mentions a negative relationship with Pfizer, with the media, the government, and society as a whole. But during COVID-19, they all worked together to end the COVID-19 pandemic, and this now puts them in a positive relationship, and they can all work together to solve issues such as healthcare reform and drug price scandals that could potentially benefit all parties moving forward. Now, Pfizer does still face challenges in the future, but if they stick by their social responsibility statement, they stick by the triple bottom line and their mission, they will be well positioned for growth and profitability in the future. And that concludes my Pfizer presentation, and I thank you for your time.